Memorial Clinic. It is a center of excellence. We have another that targets market community in St. Balikudembe in Kisenyi. And it has well over 8,000 clients, and it also provides quality services. And then we support the Art Clinic of Naguru, where we provide the comprehensive HIV prevention, care, and treatment services. So it's been a journey again, as I mentioned, that AHF, through continued resilience to fight HIV, as a government, we started, as a program, we started by providing free antiretroviral drugs. Because then, and we were one of the first organizations to provide free ARVs. And along the way, we realized that there was need to champion HIV testing and ensure that we identify people who actually needed ARVs. We have run campaigns. The Testing Million campaigns, for example, in 2009, enabled us to reach out to so many people and offer them testing services. The other thing was building capacity and empowering communities to appreciate that there was need to do HIV, to access HIV testing services, and therefore get enrolled into care if you're HIV positive. And for those who have been negative, I think we have contributed to the general slowdown in the new HIV infections and prevalence, especially across the country, because we are in about 28 districts, meaning our impact is felt, and we have contributed quite greatly. There are challenges. One, it is one thing to counsel and encourage a client to access services, but clients come with their own issues. There are different issues that may affect them. For example, clients may not be able to disclose their status to their loved ones, and that way they fail to adhere to their treatment, and that affects the outcomes of the treatment that the client is on. And that way, we again see that client get lost out of care. So getting to track down to ensure that these clients are brought back to care has been one challenge that we have gone through, but we are working towards it, and we are actually realizing and registering quite a big number of clients getting back to care. There were quite a number of issues that sent them out of care, and now we are trying to work towards ensuring that we fill up the gaps that were there that sent the clients out of care and treatment. But not just looking at HIV alone, but we like I mentioned, comprehensive services. We also offer TB services. We offer TB services, TB tracking services in the community, and we work with community structures. I told you that we empowered community-based organizations because aware that we could not be everywhere. We had to empower community-based organizations to get down to the community and offer free HIV services on our behalf. And that enabled us to register so many clients getting into care, and then also changing behavior amongst those that were having risky behaviors, but upon finding themselves negative, they were able to change their behaviors. And accordingly, we have also been able to support government efforts in providing free condoms. And so we procure about 6 million condoms annually, and we distribute them through hotspots. Hotspots are places where sexual activity is very, very high. And so we have supported so many subpopulation groups that are at high risk of HIV infection in accessing a free but quality condom. Our future plans are to ensure that we completely end occurrence of new HIV infections. And how do we do this? We are looking out for the remaining about 200,000 people who are expected to be HIV positive, but either do not know or seek to decide to stay home. And so we are looking out for such kind of clients, bring them on board, provide care and treatment, because we know treatment is also prevention. Once someone is on treatment, their capacity or ability to infect is completely reduced for as long as they adhere to treatment. We are also providing cervical cancer screening. It is a very rampant condition now, cervical cancer. And so at our facilities, we provide cervical cancer screening services to women in reproductive age, so that they are able to monitor their health even as they take care in terms of adhering to their medications. So that is very critical. We are also, supporting government efforts in ensuring that TB is also ended, because TB is another deadly killer disease. And so together with government, we are putting in our efforts to end TB by doing community tracing activities and screening every client who is suspicious of having TB and giving them treatment, especially among our patients, because TB takes advantage of an immunosuppressed body and it gets into affects HIV patients. My appeal to the public, first of all, is that we need to take responsibility of our lives. HIV is mainly transmitted through unprotected sex with someone whose status you don't know, or someone whose status you actually know. So that means engaging in behaviors that are predisposing. And so we want to call upon the public, our people, to adopt behaviors that can protect them from getting exposed to HIV infection. I would like to specifically call upon the young people to learn to abstain from sexual activity until when they are ready. For those that find themselves unable to abstain, we encourage them to always remember to use a condom. But also for the young men, we want to encourage them to seek circumcision services. They are free in all government facilities. We also want to encourage those that are continually at risk of HIV infection, like people who are in discordant relationships, to use a condom, but also seek other technologies like PrEP,